cordoned off. You've got police at all the corners.
A reporter points out what's believed to be the epicenter of the deadly coronavirus outbreak in China, a seafood market in the city of Wuhan. Tonight, the city of 11 million people is quarantined with no one allowed in or out as health authorities struggle to contain the virus. But that hasn't stopped the death toll from rising and the number of cases to spike significantly.
Public health officials acknowledge they're now testing several people here in British Columbia to see if they've been infected.
It's just one way officials are ramping up the local response to this outbreak, with the focus very much on preparing BC medical workers and hospitals for the possible arrival of the virus.
CTV's Penny Danfoss is live at Richmond Hospital tonight. And Penny, considering the location of that hospital, they're certainly not taking any chances there.
They have an isolation unit here because it is the closest hospital to the airport. That being said, the CDC tells me that they expect every hospital to be prepared for possible cases of coronavirus, and that preparation is a legacy of the SARS outbreak. They have the tools to test for it, and BC health officials want to know for sure if coronavirus has arrived here.
We've had about a handful that we have been testing and following up. And they're unlikely to prove to be cases, but at this stage, because globally we are in an all-out public health effort to identify cases early with a goal of trying to contain this virus.
A virus that's seen Chinese officials close off Wuhan City from the rest of the country to curb the death toll, sitting at 17 with more than 500 confirmed illnesses worldwide.
This is an evolving and complex situation.
Canada's top doctor is on the WHO panel, which could decide as early as Thursday if this coronavirus is a global health emergency.
To proceed, we need more information.
Until then, Vancouver, Toronto, and Montreal's international airports have notices urging travelers from Wuhan to report any illnesses, with quarantine officers on standby. BC health officials are also monitoring social media for unverified posts like this one, circulating from a WeChat conversation with a North Shore resident claiming to be homesick after visiting Wuhan.
During any evolving public health event, there are various motivations involved in the way that people behave, and so it's really important, if we want to be able collectively to work toward containing this virus and not drain public health resources in chasing false signals.
But with 5 people under surveillance in Quebec after possible exposure, and Ontario health officials anticipating cases will reach Canada, no one is taking any chances on an illness from the same virus family that brought us SARS.
So, Penny, what are officials saying today about the severity of this virus and the body's ability to actually fight it?
They're still trying to figure out a lot of those details because we're very early in this outbreak, but a number of experts have told me that if somebody does come down with the coronavirus, the vast majority of people will just fight it off like the flu. In fact, it's a lot more likely that you will get the flu and just deal with that the same way that you would at any other time of year. The CDC does say that if you know someone who has been to Wuhan and has flu-like symptoms, you should encourage them. For example, those social media posts, they want to hear directly from sick people. Scott.
Okay, Penny Danfoss live in Richmond. Thank you, Penny.